For those that don't know me, my name is Lori Steele, and I work within the SUD Voucher program. And I also have two other BHD team members who will be helping with the presentation today. And I'll let them unmute themselves and introduce themselves.
I'm Natalie. I'm the other half of the SUD voucher team. So when you're receiving emails, if they're not from Lori, they're from me.
And I'm Angie, and I work at the Behavioral Health Division, and I'm assisting with the training.
All right, so I'm going to go ahead and share my screen. By the way, I just want you to be aware that we are recording the presentation. And we do plan on putting it on our website. I don't know how soon we'll get it posted, but for those of you that want to have a copy of the recording, you could just email the voucher, the SUD voucher at nd.gov email, and let us know if you want a copy of it, and we can send you a copy by email. Okay, so I'm going to go ahead and get started and share my screen. Okay, today we'll be presenting on the provider portal system, the PPS as we call it. And this is a system, web-based system that helps manage the SUD voucher program. We developed the PPS back last February of 2020. And for the most part, we developed it. It's more efficient, completely electronic and paperless, streamlined communication for providers, and easy tracking for providers. The training we'll be going through today are on the PPS processes. I'm going to go through briefly how to access the portal and how to obtain a provider account, the ND login account. So if there are specific questions, if you have not had access to the portal yet, please feel free to raise your hand and unmute yourself so we can answer your specific questions if you have any on that. So how to obtain an ND login account. Each program must have an ND login account to access the PPS. Your program should already have an ND login account if you're registered with the North Dakota Secretary of State. So you can use this SOS account or create a unique login to access the PPS. Although each program can only have one ND login account per program, each user within the PPS can register and have their own unique login account to access the PPS. So the two links, if you have an existing ND login account, so if you want to use your ND SOS account, you can click here on the
number, and I can hear it.
Okay, how do you get to the phone conference?
On that Microsoft Meetings, and it says join on your computer or mobile app.
Just as a reminder, if you've joined our presentation, if you could unmute yourself, please.
Or mute yourself.
As you're coming in.
Jeffrey, you have to go back and then.
Okay. So like I said, if you want to use your ND SOS account, you can just click here, and this will take you directly to the North Dakota Applications portal where you enter your username and your password, or you can create a unique ND login account, and that will take you to the registration page to register a own ND login account. So for those programs that have several locations, each program must have their own ND login account per program. Does anybody have any questions on that?
I just wanted to say that somebody who's in on the phone number 701-476-7200. You're not muted right now. So when you do talk, we can hear you. I don't know which one. There's 4 people in on that one.
Okay, I'll continue. We're going to go through the provider account. So this is after a person has an ND login account, the program's into the system. This is the provider account application page. So the provider account tab is on the far right here. So there's a primary contact for each program. So the staff who will be working in the SUD voucher program, we're recommending you have one person who's responsible for adding or removing contacts. So how to add a contact is you go under provider account, you click on add contact, you enter their first name, last name, and their email address where you want the invite to go to, click submit. And then under the provider account, you select from the drop-down list and send invitation email. So the the individual you're submitting the invite to will come up here. And then once they're in there, you click send invitation email. That new person will get an email invitation, something that looks like this. And then they click the SUD voucher provider link in the email. Here's the invitation email that they will receive. The code is, if it's not redeemed within about 24 hours, it expires. So make sure you redeem the invitation within that 24 hours or you'll have to be resent the invitation again. But all you do is hit redeem code. And then the provider account ND login page will pop up here. And this is where you enter the ND login and your password. We do recommend that each user has their own ND login account just for identification when an employee is submitting a release of information or a prior authorization or invoice, then we know who to contact if we have questions for those submissions. Okay, does anybody have any questions on the provider account? Okay, I will move on to the individual application process. So there's two ways for an individual application to be submitted. We have a public website where an individual can submit their application online, which the link is here, or the provider can assist and submit the application through the portal, which again, this is the direct link to the portal if you click on this link.
Great. So she's using a lot of visuals and we can't see it.
All I've got is music. It's not letting me in.
You don't even need it because you can't, it doesn't make any sense. You can't.
Okay, so I was going to note, again, whoever's on 476-7200, I don't know, somebody who's calling in, you're unmuted. So anybody that's calling in, make sure that you hit and mute yourself. This did come up too, there is the option to print out the SFN and have the individual fill it out. But rather than sending it in to us to have us fill it into the PPS, you'll then have to take that physical copy and enter the information into the PPS yourself on the voucher on your provider portal.
Yes, that's a good point. Thanks for bringing that up, Natalie. Again, so just to go through review again, the individual can click the link online, click the start page, complete and submit, which will then come to us on the administrative side, or the provider can go under active individual applications tab, click on new individual application, click start page, the complete and submit with the individual. So just some information and documentation you'll need to submit an application. If the person does have active Medicaid, we would need their Social Security number, Medicaid number, and any other secondary health insurance information. If they don't currently have active Medicaid, they would still need Social Security number, any insurance information, and also monthly income information such as wages, self-employment wages, child support, any Social Security benefits or other retirement benefits, and proof of monthly income, pay stubs, or tax from previous year. So we did have a few enhancements in the portal over the past few months, and this will be the page once you sign into the portal. So there is a new tab called Active Individual Applications tab. And this is where you'll be doing most of your work when you're submitting prior authorizations, invoices, outcome measures, and releases. So if you need to submit a new application, this is where you would go and you click on New Individual Application. The start page will show up and then you just click Start. And then after you answer all of the questions, you sign it, date it, and then click Submit. And you'll get a message that tells you your application has been received, and you will receive a notification it's been completed and allow up to 5 business days for processing. Are there any questions on the individual application process? Okay. Now we get to the release of information. So this process hasn't changed at all. We just added a provider notification once an ROI has been determined, like eligibility or approval or denial. So the providers would have an individual sign a physical ROI. And then in the PPS, you go to the Releases tab, click on a new release of information, answer any questions for tracking purposes, and then you would attach the physical documentation, the ROI, and then click Submit. So in the provider portal, under the Releases tab, there's a new release of information button. You'd click that. You enter a client name, the treatment provider auto-populates, and then you answer questions if the authorized is through payment, or if you click yes, you have to identify the authorization date when it expires. And then you click on, you can enter a date or choose from the date picker as to the signature date. Then you'll want to choose file to upload the physical ROI and then click submit. And this is the notification that you'll receive once the ROI has been reviewed by the BHD staff, whether it's been approved or denied. If it has been denied for some reason, there'll be a denial reason listed in the email. And then you're able to check the status under the individual application dashboard, whether it's valid, and it'll show the expiration date and voucher number along with the record. Okay, I'm just going to go through. So you're probably familiar with the active vouchers tab that we previously had. So the active vouchers tab now is basically used for your reference to review anything that's been submitted, prior authorizations, invoices, outcome measures, and releases of information. So this is the first page of the active vouchers tab. So you'll see applicant name and then voucher ID. Once you click on an applicant name, it'll take you to the client dashboard. And it might be hard to see here. And so in the client dashboard, we'll have individual applications, releases, prior authorizations, outcomes, and invoices for that individual voucher. You're still able to view and print applications in here. If you click on the record underneath here, you'll be able to view it, and if you need to print it, that's also an option for you.
Hey, Lori, there's a comment that we have staff waiting to be admitted into the meeting. Do you have any more people in the lobby?
See if I can get that done here. Yep, I just allowed them in.
This meeting is being recorded and/or transcribed.
Okay, if you're joining the presentation, I'll ask if you can just please mute yourself.
And for those who are just joining, oh, muted me. For those who are just joining, we will have a recording of the entire presentation available. So if you want that, just email the voucher and let us know, or let us know in chat here before you leave.
Okay, thanks, Sarah. You can let me know if there's anybody else waiting. I can let them in. Okay. Okay, so this is the new tab in the provider portal. It's called Active Individual Applications tab. Like I said before, this is where you'll be doing all of your work when you're submitting releases of information, prior authorizations, outcome measures, and invoices, and this is where you can track authorized funding and payments. So under the Active Individual Applications tab, you'll see the record, which is the individual application number, the applicant name, voucher number, submitted on date, processed on date, and then status of application. Once you click on an individual, the individual record, it'll take you to the individual application dashboard, and that's where you'll see the tabs where you'll be submitting any new releases for the individual, prior authorizations, outcome measures, and then invoices.
I do want to make a note too that how it's set up right now, if you don't have a release already submitted and validated by BHD staff, they won't actually show up in that active individuals application list. So what you'll have to do after you submit an application is go into that releases tab right next to that highlighted portion right there and create a new record there. So then in the future, when you need to do updates on ROIs, you can go into the tab where Lori just showed you.
Yeah, that's a good point, Natalie. This is for any new releases after you've submitted that initial release under the releases tab. All right. And this just shows you under the invoices tab, you can go in and check the status of any invoices that are pending, approved, denied, paid, or potentially closed. You can click on them, you can sort by filter, and then you can download it as an Excel document. And I've just briefly put a little snippet here where you can also search here for invoice numbers. If you do like a partial INV 10-0, it'll show all the ones that show up as like a 10-0 for here. I just did an example. You can search by that as well. Okay, we're gonna move on to the prior authorization process. Natalie, do you want to take over?
Okay, we'll see how well this goes. All right. So everything is going to be linked to that individual application that is currently active. It's essentially an episode of care, so everything that occurs from that application as an episode of care will be linked to that application. So I just wanted to make a note of that. So am I on?
Oh, just scroll down. You're on 31 now. Oh.
Ah, all right, let me bear with us. All right, prior authorization process. So just like before, you are going to submit a prior authorization and we will receive that notification, review it, and once we approve, deny, we do have the option to partially approve now. You will get notification of that and the available funding will be located in that individual dashboard that Lori was just showing you. So hopefully I can zoom in on this or blow it up a little bit so you can see a little bit better. But so we've changed some of the, oh Jesus, oh, sorry. This is how it goes when I use technology. Just
Lori,
meant to have a chalkboard.
there is one more person waiting in the lobby.
And Natalie, I just realized, like, since you have control, I can't get back to the lobby.
Oh, well, let me just stop control for a second. You should have it again. Let me know when I can request it.
All right.
We apologize. Teams is not the best for meetings, for trainings and things, but it's what we have to work with. So
Okay,
good.
go ahead.
Okay. So I'm going to try to not screw this up again. So our parameters chart here, we have a guide on what is, so we obviously need medical necessity, as always with any treatment services. So we've got some maximums that we had set based on your treatment plans. So let's see, I don't know if it's probably going to be pretty fuzzy for you guys, but so this is about as good as I can get. So say for ASAM 2.1, you have an individual coming in that needs level 2.1. The maximum units you can request per prior authorization is 50 units, and that can span over a total of 120 days. We have the authorization limits, just to kind of tell you what that's going to look like financially. Once you submit the initial care request, there's only one that can be requested on each individual application. So if you go through your 2.1 and you use that up, and I'll probably need to get into this too in the next slides, so I apologize if it's redundant, but you're going to need to submit a continuation of care. So what we're going to do with that is you have so many continuations of care per different service type before we have an LAC review it on our end for medical necessity. I don't think there's going to be a lot of issues with this. We do know that you guys know what you're doing. There just is some bases we want to cover with how we are approving care through the voucher. So what you'll do is I can't scroll because then it just, I don't need to scroll. Sorry, guys. I need to find where I just was. All right. I'm going to try not to touch that. I use my trackpad too much. So just like what Lori had been saying for all the other processes, we're going to go into that active individual application page, and you're going to locate the individual that you want to submit a prior authorization for. So here we're going to go into Carrie Underwood needs some treatment, and you'll click into that individual application just like you did before. And you'll see that same tabs like Lori showed you. You'll select here the new prior authorization button. And I think I'm like, don't have some of the controls, so they can't drop down. So once you hit that new prior authorization button, this screen is going to pop up. It should auto-populate your service provider location and the client name as well as the individual application that it goes to. You'll then enter a DSM-5 diagnosis and the type of service request. So we've got initial request for treatment, a continuation of treatment plan, a change in treatment plan, or transportation. Transportation will not be requested with other services. It will have its own prior authorization moving forward. Once you click through that and submit, you will then add service types here. And this is where you will go in and select the service types that you have that are that follow the treatment plan. So after you select your service type, you're going to, I think I skipped past that, maybe there's a screen. So you will have to select how many units of each service type that you are requesting, an anticipated start date and an anticipated end date, and you will then submit that. Once you submit those service type requests into the prior authorization, you will then have to add in documentation. So for general services, treatment services, you'll have to submit a treatment plan. If you are submitting a transportation request, we will need either a map to show legitimacy of that location, that individual's address and round trip information, so we can verify that the number of miles requested is consistent with what you would need, or a travel reimbursement plan. So you can choose that document, and once you go through that process, you will then submit. So once you hit the submit button, you've gone through all those processes, it's going to appear in that dashboard as pending with the requested amount. We will receive that on our end, and we will review it, approve it, partially approve, deny with reason, and you will get that communication. Once that happens, you'll see an authorized amount here. So initially, it's submitted as pending in the amount that you've requested. And once we've reviewed it, it's got the status tag, the amount requested, and then the amount authorized, and the amount available. So assuming that you haven't submitted anything on a prior authorization, the amount available should be full. And that is it for prior authorizations. Do you guys have any questions on that? No? Lori, anything to add? No?
Nope, I don't think we have anything.
Okay, so we'll move on to outcome measures. This is another thing that we have implemented into the PPS. It wasn't there prior, before we were using an outside source to complete these. Click on there. So baseline measures, we're going to have that required before you can submit billing for an individual. So whenever somebody starts treatment, or if you're submitting, say they have been in treatment for a while and you haven't submitted any invoices on them since we've implemented this change, you are going to get a prompt if you try to submit an invoice that says that baseline measures need to be completed. So we are requiring baseline measures. It's just our way of, you know, this was always technically required, but it's our way of ensuring that our requirements are met. So you're going to go back into the same place that we're going through all these other processes with, the Active Individuals Applications tab, and you'll find whatever individual you need to submit the outcome measures on, and click into their individual application record. And there will be a button there for outcomes. And you want to select new provider outcome. And this is what that first screen should pop up as. So it will auto-populate your provider name. And this will all say CMS Fargo because we just had to input a provider name through our test site. This is where we're seeing these screenshots from. Client name should also auto-populate, and then you'll have to select what kind of data you're going to provide. So baseline measure for George Strait, a lot of country stars coming for treatment in North Dakota. And then you're going to go through that provider outcomes questionnaire. So every single question on here is required. You'll see by the asterisk that's noted. And you'll click submit. And once that's finished, it will go into their outcomes tab right there. So it'll show the submitted on date. We'll get notification that it's there, and we can review it. And then discharge outcomes, it's going to be essentially the same process. There will also be an annual update tab. So instead of requiring yearly research, we will be doing annual updates through outcomes. So that should be happy news for you guys, so you don't have to submit applications every year. Essentially, the same questions. It's just a measure on how the change has, or how changes occurred. Submit, and it will also pop up in that outcomes tab there. So create and submit annual update. This is the same process. And once completed, an annual update will show up in your outcomes tab. That can kind of give you some basis for remembering when somebody needs to be updated. So if you're looking in their chart essentially, and you see that their last annual update was in June of the prior year and it's June now, you know, it serves as a reminder that, hey, we need to get that in, otherwise invoices will not be, you won't be able to submit invoices again. So any questions on outcomes? Nothing? Okay. Moving on to the invoice process. So I'm usually the one that's in processing invoices. So if you're submitting invoices and you hear from me constantly, hopefully things that we're implementing will make it so you don't have to hear from me so much. So creating an invoice, same process as before. As usual, go into that active individual application tab and select the individual application that you will be submitting an invoice on. Go into, it'll pop up here, and you'll go to new invoice. It will auto-populate provider name and client name, and you need to fill out the other two questions here, if it's a final invoice or if the service is related to treatment provided in a residential setting. You will then click down in the drop-down box and select a service type and enter the dates of services from a date picker. So on one single line item, months can't overlap. So you can't select ASAM Group 1 and enter dates of service for April and May. It has to be just April on one line item. You can add another ASAM 1 line item and put May in there, or whatever other month you have. It just can't be in the same line item, and then you'll select how many units that you're billing for. Once that's done, you will hit submit. And I want to note too that some of the changes before, it had been that even if you were requesting payment for services that weren't listed on the individual's prior authorization, they were able to go through. That will not be allowed anymore. Our system will prevent that from happening. If you have services that you want to request reimbursement for, and they aren't on that prior authorization that's active, you'll have to submit another prior authorization to include those services. So adding additional services, same exact process. You just click the add service button, click your service type, the units, the start date, the end date, and the dates of service. And you will submit after that. Once you submit, it will show up in your invoices tab as pending. We'll receive notification of that then, as we have been, and review and then approve or deny based on, you know, whatever we're seeing. And you will get, I don't think you'll get notification of them if they're approved, but we will notify you or if they're denied. Going to once a month. We want you to submit billing for an individual only once per month now. So if you had been submitting billing on individuals, you know, weekly, bi-weekly, or, you know, randomly whenever they'd come in to receive services, we are asking that moving forward, you submit once per month. We won't actually be accepting invoices if they are submitted, you know, from those other time points. We'll just have to deny them and have you submit them all on one. And we will be going through and approving or denying, just reviewing everything between the 1st and 5th working day of each month. And the batch approval process will take place at that point as well. So it will go to our fiscal department at that point once we go through the review process. Once it's been paid, that will show up in the status, along with whether it's approved or denied. So you will be able to track where invoices are at throughout the entire process. So do you guys have any questions on that?
Hi, Mary. This is Chelsea. I drew the invoice submission for CNS. The only question I have about that part is if we're going back and doing like back billing for something that had denied a month prior or whatever,
Yeah.
that can still be submitted then, right? Is that correct? I understand it can be submitted on the same invoice that contains other months, but I just want to be clear that we can go ahead and submit those.
Yeah, they just have to be on different line items. So on that too, and I see there's some other hands up and I'll get to that in a second. So we will be moving to 6 months rather than 60 days for timely filing. So before it was just out of pocket expenses had that timeline, the 6 months, but we're moving all of our billing to where you can submit for 6 months post service date. The only exception right now is that we have to have all of our the 2019-2021 biennium billing in to our fiscal department by the 8th. So anything that's occurred in this last biennium, June 30th and prior of this year, has to be submitted at the very latest by June 8th.
July 8th.
Or July 8th,
Yep,
that's what I mean.
July 8th, next
July
Thursday.
8th. Okay, so did that answer your question, Chelsea?
Yes, it does. Thank you.
Okay, so I'm gonna go to, I think Lucy had her hand up first.
Hi, quick question. Are you gonna allow corrected claims at all to correct the invoice?
What, so if it's denied, to submit it after it's been corrected?
After it's paid?
After it's paid.
Say, for instance, maybe somebody got insurance or something that retroactively became effective. Would we be able to do a void through there?
So what I think you would do at that point is let us know so we can let our fiscal department know, or we can get you our fiscal department's contact information. And you could let us know like the invoice, the information on the invoice and the payment details. At that point, say somebody's insurance went and covered services that had already been paid through the voucher, which we very much appreciate. That's actually in our MOA that that has to be done because we are to be the payer of last resort. So I do want to stress on that. We've paid a lot of claims that could have gone to Medicaid or to another source, and to ensure the funding lasts throughout the entire biennium. We do really want to push for those things to occur where if something comes up, you would then have to refund the voucher for it. So we would go through the fiscal department to do that.
Okay. I was just wondering if there's an option. Is it going to be a requirement that they complete a Medicaid application?
Yeah.
If they're eligible, that's what we would recommend.
But
to
is it,
help them.
Is it a requirement?
So
if they're eligible, it should be required, right? If they're
yes.
eligible for Medicaid, they should be applying for Medicaid.
So if you can kind of look and see that it's pretty sure that this person is going to be eligible for Medicaid, even if you're not 100% certain, go ahead and put a Medicaid application in. You could be missing something on the Medicaid end that they might accept the individual or even put them on expansion, because it is in our MOA that we need to be the payer of last resort. And that was a big topic during legislative session, was that we weren't really holding people accountable for making sure that we were the payer of last resort. So yes, by proxy through the legislation or in how code is written, because we are to be payer of last resort, if there is available options, they do need to be exhausted. So if you see somebody that comes in and they're for sure or probably or potentially a Medicaid or a Medicaid expansion candidate, apply. And I don't know if it was listed somewhere out here, but we do need to be notified. I know it's in the MOA. We need to be notified of insurance status change within 5 business days. So did that answer your question, Lucy?
Yeah, it just becomes kind of a staff, we're just trying to figure out how to staff that,
Right.
because some of those applications aren't user friendly or for clients to fill out.
Right.
So just trying to figure that out and if it's going to be a true requirement before submitting. And what the turnaround time is going to be. Are we still looking at 45 days? Are we going to expedite those that are sent? Do we have somebody in particular we can send those applications to? Because billing for 45 days has a
Right.
effect.
And then it's going to be an issue of remits again. I will say that there is in the field services division, is that right, Lori?
Yeah,
Field services.
under medical services, under DHS, this last legislative session, they approved an FTE for a person that will be working under medical services to help providers submit Medicaid applications for individuals who appear to be eligible for Medicaid. We don't know what that's going to look like right now because it's such a new position, but we'll be working closely with medical services, and then we'll provide guidance to all the voucher providers on what that process is going to look like and what hopefully it's going to be helpful. Like you said, the application process is not user friendly, so we will have a position to help with that transition, helping providers apply for the Medicaid for individuals who appear to be eligible for Medicaid.
And that's for voucher recipients too.
Right.
So if somebody's applying for the voucher, and like Lori said, we don't know exactly how that's going to look. And we're hoping that position is filled, like nailed down and everything soon, hopefully before the end of the year. We can't be sure, obviously. Lori and I don't really have all that information, but somehow they will be getting notified of voucher applicants, and then they will be looking at whether or not they're Medicaid eligible. And hopefully that process too, just having that person will have the entire process of applying for Medicaid expedited because there's somebody working strictly with this population. So Gary, you're next.
Okay.
I saw.
Thank you. I have a question with regards to if an invoice is denied. Does it deny just for that invoice or for the entire batch of invoices that have been submitted? And if there is a denial, will there be an explanation of why it's being denied?
Yep. So that process is already in place. So it just denies that one invoice.
Okay.
And we have to provide explanation that's for our own data collecting purposes, as well as it does automate a message and send it out to whoever submitted the invoice will get the email, assuming that they are under an account that they have access to. Somebody within the organization will get that email, and if it's a general service provider email that they're working under, the person who gets that will then have to obviously forward it to their billing department. But it will say, denied because transportation requested exceeds actual transportation traveled per map provided. Something like that. And you will get the chance then, you can obviously, as long as it's within 6 months of the service date, you can just go ahead and resubmit that invoice you'll have to create a new invoice and put the service types and dates and everything that is changed to follow the parameters that we outlined in the denial.
Okay. Okay, thank you very much.
Yep. Sherry Peterson, I see you got your hand up too.
Yeah, yes, I had a question about the application for medical assistance as soon as possible. What does that do, and what will that look like if they are in a facility that has over 16 beds where they are not eligible to receive MA services while in that? So that might impact other providers that are working with the individuals that we serve as well.
Right.
Right. So for IMD programs, this last legislative session, there's a 45% cap on residential services. So that's why we have that question on invoices right now. So we're asking the provider to, if you're submitting an invoice, you have to answer yes or no if the service is related to residential treatment. And so we understand that IMDs are unable to bill Medicaid for residential services, only for outpatient. And that, so we have to send quarterly reports on our budgeting this year to legislatures. So they will be notified of our spending, this biennium. It will have an impact, but we're also not able to accept any new IMD providers due to our a lack of funding or appropriated funding that was exhausted last biennium. But the IMD providers that we do have right now can continue on the voucher provider. We just have to submit quarterly reporting to legislatures.
So
One example, oops, I'm sorry. One example might be if they're in our facility and then they go and receive services from like Ideal Options or CMS or wherever they might go for services, they also can't be on MA for those services.
Is that so? If they are receiving treatment at an IMD, they can't receive services through Medicaid through another treatment provider. Is that what you're saying?
Correct.
Okay, I was unaware of that. What we had come to understanding through conversations with Medicaid, and I could be wrong. I don't know, Lori, was it well, I guess it was essentially the direct opposite of what you just said. So
Yeah, we'd have to check with Medicaid on that because I guess I wasn't familiar with that. I'm not sure how Medicaid tracks that. If a individual is receiving services through an IMD and they go to, say, another place for outpatient services, that provider that can't bill Medicaid for outpatient because that person's receiving services with an IMD.
That was my understanding.
okay. I feel like we had a conversation at one point with Medicaid that I believe was that it was just the services received in an IMD residential setting that couldn't be billed to Medicaid. So we'll have to check on that, and we'll send out communication to our providers. But that's, Lori, you taking a note on that to send a
Yep, I
message
got
over
it
to?
noted here. Yep.
Okay.
Thank you.
Yeah, so it looks like those are all the questions, the hand raises that I had on that. Did anybody else have any questions regarding anything in general?
Hi, Chelsea again. I just did want to ask, when it comes to the invoice denials, does SUD, at any point in time, would they be adding the denial reasons into the portal just because, like you mentioned, the invoices would be emailed out to whoever put it in, and then if it's denied, then I get so many emails all the time, and then some
Yeah.
of those can get lost in there too. And then it's really tedious to have to go back and enter in a security code, get back into that email. And sometimes those security codes don't even always work. So is SUD going to establish a way to review the denials on the portal itself without having to go through all those extra steps?
I believe if you click into, so if you see on the screen right here, where all the invoices will show up under the invoices tab, and we do have somebody on here, Sarah, I'm gonna call you out here, but I believe if you click into the record, it should have that denial. If it's a denied, so you might be able to filter out or sort through anything that's denied, and click into it, and it should have the explanation there in the invoice that we provide. Is that
And
right?
is that new? Because I know prior there was no way to review a denial. It would just give me the status of it being denied.
Let me
Yeah, I
actually,
don't think that's set up yet, Natalie.
is
I know that's
is that
something
one of
that
the
we had
things?
talked about, explaining the denial reasons within the portal so they can go and view, but I don't think that's quite set up yet.
Okay, so there are, I should note, there's a lot of things that we are working on because of the amount of work required for what needs to actually happen in the PPS. There will be a lot of updates continuously happening. So if that is not currently one right now, hopefully, and we'll have to talk to ITD about that if that's something that is going to be implemented, or we'll have to have a conversation about that. But that's a good point, and thanks for bringing that up, because we don't have it on the other end. We have our work on our end, and we know that we don't know a lot of what's going on your end. We are also hoping to have a essentially like a test account, so we can kind of see what you're talking about when you submit an issue that you're having, because we can't technically see what you're working with in your dashboard. So that will be something that we bring up in one of our next meetings with ITD then. I don't know if it's going to be something that's really difficult to implement or to build into the system, but we can sure try. And we will be sending out notifications. We'll probably have trainings every so often to highlight some of the changes that are occurring in the PPS. So you guys can look for those too, but we'll try to send out notifications as soon as changes occur and things that you can expect.
So Natalie, this is Sarah. I'll just, you kind of called on me and I can give a little bit more clarity on timelines for this. So right now, when we're looking at invoice line items, there's a free text field where we're able to put in whatever it is that we want to explain why we might be denying an invoice line item. We don't at this point in time have the ability to even partially deny an invoice. So if you bill 100 units and we can see that, yeah, there's 90 units that are payable here, we want to be able to just pay those 90 instead of denying the whole line item and having you rebill with 90. So to accommodate that, one of the things that we will be doing, and I'm thinking probably in the September, October range, is implementing drop-down explanations that explain if we're paying something, it's paying per fee schedule, and if we're partially approving something, then we would have additional explanation, and if we're denying something, why we're denying it. So they would be really high-level kind of standard medical billing insurance reason codes. That would be going in there, and then we would have that documentation on the back end that would provide that more high level explanation about why something was denied or partially approved. And that more detailed explanation is what would go in the email. But yes, we will be enhancing the invoice line item where Natalie was showing you can click into the invoice and see more details about it. And you would have that then ability to see high level what we did with each invoice line item.
Thanks, Sarah. She's our guru. She understands more of the ITD process than I do. Obviously, you guys have seen how good I am with technology. So she knows all the processes, the entire start to finish. each piece of everything that we're implementing into the PPS to make it more user-friendly for you guys and for us to be able to collect sufficient data and to be able to monitor the funding and everything. So that's why these changes are occurring. We're going to be more scrutinizing on, or I guess our system will scrutinize more for us for a lot of the requests, whether it's prior authorization, it might notify us that this is a continuation of care. And this is the third one, it might need to be reviewed. Things like that you might not catch normally. Just having two people looking through a massive amount of documentation that we already are. So hopefully it benefits both our division and all of you as providers and people working within the PPS, and then will directly benefit the recipients of the voucher program. And that's our hope, is to keep everything person-centered and to be able to utilize our funding in the best possible way so that we can help the most amount of people. So, oh, I got a clap. Thank you. These last two slides. So technical assistance. I
just want to make sure real quick, Natalie. Chelsea, do you have another question, or did you forget to just not or unraise your hand? Is that what you say?
Yeah, I guess I didn't know I could unraise it.
Oh,
That was
okay. I
for
think you
the
just
invoice.
okay.
Okay.
Just want to make sure you didn't have another question for us.
Yeah, no, sorry. But while we're back on that, did I hear correctly that the invoice reviews were going to be done on the 1st through the 5th?
Yes. So we will be doing them.
So they'll be paid the 1st through the 5th, but we're asking for you to submit them just once a month.
Okay.
Which if that's Chelsea again, I think. Yeah. You guys already are doing once a month for the most part. So
yeah,
nothing to change on that end for you guys.
All right. Just let me clarify that. Thank you.
Yeah. So we're good. Any other questions on anything? Anything come up in the last couple minutes? Looks like no. So technical assistance.
There is another question from Gary.
Oh, okay. Gary, go for it.
Okay. A general question, as I understand, and Lori and I had a conversation yesterday afternoon, and I didn't think about it until this morning. But with regards to the process of we got invoicing for the month of July being done in the first part of August, and then the payment being made within the first 5 days of September. What is the reasoning? I'm looking at cash flow purposes for our company, and I'm sure all the other organizations on the line are impacted by the cash flow also. Why is there a delay for that following month to make a payment rather than making a payment like a week after the invoices have been approved?
I can answer this question for you. I'm sure you've probably worked with state agencies many times throughout your career. But I don't know if you're aware of all the processes that we have to go through, how many levels of clearance it takes for something to be paid out, for really anything to happen in the state level. So what happens is we get all those invoices, and they're sitting in our pending invoices queue. We go through and review them, and there's an entire batch of approved invoices. Once we hit that date of the 1st through the 5th, that's when those invoices in that approved batch will be reviewed by somebody higher up, and so it'd be our assistant director would have to review that. She approves it. It gets put into another level through fiscal. Fiscal has they have a 2-week timeline for turnaround on their processing. And that's because I don't understand their entire process, but they have their own levels for everything to clear through. So once it goes to our fiscal person, it has to go clear through, all these other levels. And so they have a 2-week time frame. So, it would be right around, from that time that it's approved, or between that 1st and 5th date. So that would be your first week, goes through the approval process on our end, and then it's 2 weeks longer. And so I don't know how, once everything is approved and paid out, it just comes roughly right around to a month.
Okay.
So, and that's always been the process. The only difference is that we had been going through and just approving and saying at random times, and it just makes more sense to the business flow on our end to have a specific time frame of when that is expected, so that it's not that we're bombarding somebody to review something just on the fly. It can be expected that this is when this is going to have to occur, so set aside time to do this.
Okay. Thank you, Natalie.
Yep. Lori, did you have anything else to add into that?
Nope, I think you summed it up. I mean, we're trying to reduce work on board, the workload for both. Like, I don't know, like for providers submitting weekly, I don't know if that's a lot more work for providers to submit weekly. But the PPS is intended to allow to add a lot of services to one invoice. So you're not submitting numerous invoices for the same person multiple times in a month, if that makes a little more sense too.
Okay. That bring anything up for anyone? Looks good. Okay. No hands means now I will explain technical assistance. So if you are receiving an error, you can obviously send us an email and say that you're sending an error. Right now, with all the changes that are being implemented, there is the potential that something could come up where a script or code or whatever just isn't running right. You can let us know, but also letting ITD know is an option. So we've got the phone number here, and then the site. If you click into that, because you will have a ND login account, you'll be able to log in with that account and explain what's going on. And somebody from ITD usually gets back pretty quick. Our ITD is really good, I think. And like I said, if also you can, if you have any questions, if anything's coming up, we work closely with ITD right now because of all the development we're doing. So if you have an error, this actually right now might be the quickest way to have it resolved, because if you're having that error, more than likely other providers are having that error too. So just letting me or Lori become aware of that issue, we can go right ahead and talk to the person who is working on development. In the future, when everything's kind of settled down and we're done with all of our development, everything that we wanted to do has been implemented and deployed to the PPS, we don't have as directive access. So this would probably be the route that you'd want to take to actually have something occur, because then it would go directly to that ITD and they would have somebody working on it and saying, hey, it looks like a bug has come up and we have to take care of this. Rather than us trying, we would just do that same process where we'd submit an online incident too. So it would be indirect and we probably wouldn't know all of the ins and outs of what happened when the error occurred. So for now, let us know. And in the future, I'd say, Sarah, what do you think the timeline is? It's going to be so broad, but what would you assume the timeline might be for our PPS work to really be completed? Give them maybe
well, we have a series of priorities that have been identified and like the requirements drafted out for those, I would say for sure by December. Then there's another series of priorities that have not really been totally walked through with requirements developed for that. And I would say for sure those within the next 1 year.
Okay.
So everything within 1 year. And then Gary, just with what you were, saying with the concern about cash flow, I'm the quality manager for the behavioral health department. And so right now we're focusing on legislative priorities and how do we get things working in a way that allows us to provide the reports to legislators that we need to better watch our budget so that we don't end up in the situation that we did last biennium with exhaustion of funding. And then at a later point in time, when we've kind of assessed all of those needs and put those into play, then I do intend on working with all of our different customer pools of providers to identify the needs that you guys are experiencing to see what we can do to address those needs then. So I'm not saying that I will change the 30-day thing, but I just do want to make it known that I do intend to reach out to understand more about what it is that you providers are experiencing to see what we can do to make that process better for you guys as well.
Awesome. Thanks for noting that, Sarah. That's a really good point to bring up. So we will be asking for your feedback on how the PPS is working as a whole and any issues, concerns that you have, and we can take a look at those, especially for those ones that might be noted for from a lot of people. And then this last slide is just those website links. We've got the links here for your portal. So for those who haven't really accessed it, I know we've got new providers on, and so they probably are, definitely have not been on the PPS yet. We do have the link here for that. And like Lori said, especially for those who jumped in a little bit late, you will have to create a new ND login account. And that's for anybody else on your team that's joining that will be working in the provider portal. And you can reach out and say, hey, I need if you can't figure it out, I need a little bit of help getting into the portal. And we can assist you with that. We're always here. We hope to, answer everything within a timely fashion. I feel like we do a pretty decent job of that usually. But like Chelsea said, I'm sure you guys all have the same problem, tons of emails. So especially with opening back up, I think that we're going to be pretty stacked and busy, but we will still do our best to get back to you within a timely fashion. We're constantly checking our emails. We split up the duties. So then provider portal access, we've got the individual application if somebody wants to apply on their own. We've got our SUD voucher program information. That's where provider applications are. That's where eligibility requirements, all those general high level information is located, and then the ND login account registration. So that's where you would go to get access to the PPS to have something to register in. So Lori, do you have anything to add anywhere?
I don't, unless there's any other last minute questions that came up from anybody. Obviously, if you don't think of it now, go ahead and either call or email us. We're, like Natalie said, we're here, and if you have questions, just give us a call or email us. We're more than welcome to help you out. Lucy has a question.
Sorry, I just looked at my previous notes. Can you describe the annual update again? So that's required on each individual applicant to do an annual update?
Yeah.
Well, it's more for like if there is no discharge outcome on file for outcome measures, then an annual update would be required. So we're thinking that would be more for the opioid treatment programs right now. So if you do say you do a baseline measure and there's no discharge outcome, you're going to be prompted to do an annual update if there's no discharge outcome for that person. That's where the annual update comes into play.
Yeah, so if you get that notice and that person is no longer receiving treatment, then you'll know to do a discharge outcome and say, hey, this person isn't receiving services. I forgot to do the discharge. I think there's actually, there will eventually be a prompt where if there hasn't been billing on somebody for a certain amount of time, it will send you a notification and say, is this person still receiving services? You need to do a discharge outcome if not. But essentially it's if somebody you're seeing has been in treatment, so from the end of the initial application date, 1 year post. So somebody Tom comes in and starts receiving services in June. And he just continuously receives services through your facility all the way for another year. It's going to give you a notice for doing annual outcomes. So that will affect the OTPs more than other providers, because we know it's unusual to, it's not common, I suppose, to be in treatment for an entire year. But if in the case that it does happen, say somebody's receiving therapy for an entire year, then you will have to do an outcome on that for the annual update.
So it's instead of it actually having that application expire.
Yep, instead of
Okay.
having an application research. So that was one of the things we were trying to make easier on you guys, is instead of like going and filling out all the information again, we're just going to have you do like an annual outcomes update.
Gotcha. Okay.
That's a good question, though.
All right. Well, if there are no other questions, I think thank you for joining us, and look forward to new biennium with new funding and hopefully a much smoother PPS process.
All right. Thank you, everybody. Have a great weekend and enjoy your 4th.